歡迎大家收。
Welcome to today's press briefing. We have two speakers from the Center for Health Protection Communicable Disease Branch, Principal Medical and Health Officer Dr. Albert Au, and from the Hospital Authority Chief Manager Dr. Larry Lee. We'll first hear from Dr. Au. Good afternoon, everyone. I will now report to you the situation yesterday on the 2nd of May in relation to the CHP. We have PCR positive cases, 132 cases, including 27 cases confirmed by the Hospital Authority, 23 confirmed by Public Health Laboratory Service, and the remaining 82 were confirmed by private laboratories. In relation to RAT tests, RAT cases, we have 158 positive cases reported on our platform, and they've been verified. Yesterday, altogether, we have 290 positive cases yesterday. So far, we have in the fifth wave 1,192,452 cases, including PCR positive cases 746,281 and 446,171 RAT positive cases. Of the positive cases yesterday, 21 were imported cases, and the remaining 269 cases are local cases, and 13 of the imported cases were picked up at the temporary sample collection center at the airport. That includes 2 cases arriving on the 1st of May on CH274 from Malaysia, 3 arriving on the 2nd of March, riding on the CH258 from the UK, France, as well as Switzerland. There are 6 cases arriving on the 2nd of May, flying with a QR818 from the UK, and also 2 cases flying on JQ894 from Singapore. 6 cases were confirmed during the quarantine period, including 1 on the 3rd day. PCR case is a case from Taiwan. 2 cases on the 3rd day, RAT positive case from the US. 1 case on the 4th day, also RAT case from France, and 1 case on the 6th day, RAT from Singapore. The remaining 1 case on the 10th day is a community testing center case from Spain, and also 2 cases from community testing centers, 1 from the UK and 1 from Australia. The Public Health Laboratory, in relation to 75 samples, conducted genome sequencing analysis. We have not identified any L452R positive cases. 73 cases were confirmed to be negative to L542R. The remaining 2 cases contained insufficient viral load. In relation to care homes, we have not received reports of new cases that have been previously not affected. There is 1 care home for the people with disability. There is 1 additional case involving a resident. In relation to schools, there are about 2,000 schools that have resumed face-to-face classes. This morning, they have already reported relevant test results to the CHP. There are 45 cases reported by schools. They are positive cases. Of these cases, there are 38 RAT positive cases and 7 PCR positive cases. Of the 45 cases, there are 18 cases that were confirmed positive before the students went to school in the morning. For the remaining cases, they were positive cases confirmed when students and teachers were staying at home during the holiday at home. Yesterday, there were 9 positive cases and 18 that were confirmed between the 29th April and the 1st of May. They have not gone back to school. Of the 45 new positive cases, there are 37 students and 8 staff members. Altogether, there are 42 schools involved, including 3 kindergartens or childcare centers, 23 primary schools and 14 secondary schools, as well as 2 special schools. In the 45 cases, there are only 3 schools that were involved with 2 cases. 2 schools resumed face-to-face classes today, and the relevant students with a positive case did not go to school. And for the remaining school, the 2 cases were not linked. In relation to the remaining 39 cases, they were scattered in 39 different schools, and we have not found any link. Of the positive cases today, from our investigation, we found that there are 17 cases that have been absent from school for quite some time, and they've been confirmed positive today. They did not go to school. In relation to death cases so far, in the 5th wave, we have recorded 9,112 death cases, an increase by 7 cases compared to yesterday. The death rate is still at 0.76%. Those over the age of 85, the death rate is 10.545. In relation to vaccine analysis and age range, the figures are similar to those previously reported. We'll now hear from Dr. Lee about the hospital authority situation. We have 1,250 patients staying at different hospitals, the North Lantau Infection Control Center, Infectious Disease Center of the Hospital Authority, as well as the AWE. There were 2 patients in a critical condition. They have not been vaccinated. There is 1 case of a serious condition. 7 critical condition patients are in the ICU. I would now to report to you 7 death cases. There is 1 86-year-old male passed away on the 1st of May, and the other 6, that is 4 males and 2 females, aged between 70 and 95 years old, they passed away yesterday. There is 1 case from care homes and 4 cases with 1 dose, 1 with 2 doses, and 1 with 3 doses. In the past day, 90 patients recovered, including 42 patients being discharged. So far in the 5th wave, we have 48,267 patients who have recovered, including 47,434 patients who have been discharged. Starting from 2020, we have 60,647 patients that have recovered, including 59,814 patients being discharged. We have identified 1 patient to be confirmed with COVID in relation to admission screening, and there is 1 patient that is classified as close contact. We have 25,504 patient staff members that have been confirmed. So far, 22,104 of them have resumed their duties. I would like to announce a special arrangement in relation to resumption of visiting hours. Starting on Friday, the 6th of May, 26 public hospitals under the HA will resume special visiting arrangements in relation to non-emergency wards. In relation to specific hospitals, the list will be have been issued to you and will be uploaded on the internet. So far, for each patient, there can be 1 to 2 visits by registered visitors. The period is 1 hour. And has to be the same person during that period. We will liaise with families to explain to them about the arrangements. Families don't need to call the hospitals. In relation to visitors, they have to meet relevant testing and vaccination requirements. That include completing 2 doses of COVID vaccination no less than 14 days before, and then they can provide PCR negative test result within 48 hours or RAT negative cases within 24 hours.
If visitors are recovered persons, then within 3 months of their recovery, if they go for a visit, then they can be actually waived from the test requirements, but they have to present proof of recovery. For visitors in hospitals, well, they have to strictly adhere to infectious control measures. We do understand that members of the public would like to visit their family members and friends in hospital. So according to latest developments of the pandemic, at appropriate times, the visit arrangement will be gradually extended to more hospitals and wards. That's all from me today. Q&A time. Please raise your hand and wait for the microphone. And please also introduce yourself and your media organization you represent. The gentleman over there, please. I'm from Ming Pao. Greetings. First of all, I would like to ask about the social distancing restrictions. Just now the CE announced that there would be relaxation of the social distancing measures. So I would like to know about the infection risk after the measures are relaxed. Right now, the limit is at 4 persons, but in the next stage, there can be 8 persons at maximum at a table in restaurants. So in terms of infection control, is this appropriate? After resumption of face-to-face class, just now you announced the number of positive cases, and based on previous assessment, there might be 10 to 20 cases, but today we saw 45 cases. Does this mean that the risk of infection or spread is very high? And is it true that the infection rate is higher than what is expected by the center? Out of these 45 cases, how many of them are students who have already started attending face-to-face class after resumption of face-to-face learning? Just now you said 3 schools have more than 1 case, and from investigation, some cases may not be related to each other. Apart from 2 schools which resume face-to-face learning today, what about the other 2 cases? Why aren't they related to each other? Concerning hospital authorities' situation, I want to know about the AWE community facility. After it's closed, what will be the subsequent manpower arrangement? Apart from AWE, will there be closure or adjustment of service time for other facilities under hospital authority? When workers gradually go back to hospitals, will there be any timetable for service resumption in public hospitals? There are some South African studies that for BA1 recovered persons, BA.4 and 0.5, the level of neutralized antibodies may be low. And the South African team is of the view that a new wave may result. And then we have 2 cases of BA.5. So how do you assess the risk? And based on the 2 cases announced by the center, they came from South Africa. So are you going to do more surveillance on people who arrive Hong Kong from South Africa? Thank you for your questions. Let me take the first 2 questions and the 4th question, and Dr. Lee can take the 3rd question. First, social distancing measures. In the past 1 to 2 weeks, the pandemic is stabilizing, and there is a slow decline. So looking at the current situation, the CE already explained this morning that we are doing risk assessment. We refer to various numbers, including number of cases, sewage surveillance, and also the restricted tests and so on. We also make reference to analysis done by university academics in order to determine the social distancing restrictions. From time to time, we carry out risk assessment based on the then situation. And so we see which measures are appropriate by phases. Now the pandemic is stabilizing and there is a downward trend, but we need to be careful. Even though some social distancing measures are relaxed, there are still a number of cases now. Every day there are around 300 cases. So in the past 2 waves, Well, the current number is 100% of the maximum daily peak that we saw in the first 2 rounds. So there is still the risk of spread, and so you need to observe personal hygiene and wear masks. From time to time, we will monitor the latest situation and see if there may be resurgence. As regards resumption of online class today, we recorded 45 cases involving teachers and students. So we have had long holiday, and so in some schools during the holiday there are students and teachers which are tested positive. During the holiday they did not make report, and today they report back the numbers on the past few days. Out of 45 cases, 18 cases were tested positive this morning. So this is within our expectation. Last week there were 350,000 and 50,000. There are 350,000 students and 50,000 teachers which did daily tests. And every day we identified a dozen or so cases. And today the number increased a bit. Based on this morning's numbers, there are more than 2,000 schools which have resumed face-to-face learning, and more than 700,000 students have done tests. And for teachers and students in school, more than 110,000. So these numbers are within our expectation. We will continue to monitor the situation closely. Based on reported cases today, there are at least 17 cases in which the students have not attended school for a long time. This is the first day of school, and students reported back some cases to school today. So these students had never gone back to school after they became positive. For these 45 cases, there were 3 schools with 2 cases, and there are 2 secondary schools within the number, and there is 1 primary school. For those 2 cases, they're in different grades. The students do not know one another, so there isn't any connection between the 2 cases. Concerning BA.4 and 0.5, we pay close attention to WHO and also scientific studies about these 2 mitigants. And based on WHO and also overseas health organizations' assessments, there may be possibility that these 2 mutants or virus strains may be higher in terms of the ability to spread. So more studies have to be done to confirm. In Hong Kong, for imported cases, we closely monitor the genetic mutation of the virus. For all imported cases, the positive samples will be sent to the laboratory for genetic sequencing and analysis. So by doing that, in case if there is importation of mutants to Hong Kong, we are able to identify the situation right away. So we will monitor the latest situation. Right now in Hong Kong, for the time being, we have only identified 2 imported cases with BA.5. Dr. Lee, in AWE COVID Treatment Center, well, tomorrow it will be converted to a standby facility. And manpower there, some of them will go back to the cluster hospitals, and some will stay in AWE and North Lantau Infection Control Center to do preparation for the 6th wave. In terms of manpower, when the pandemic gradually improves, some hospital service will be resumed. On the other hand, we are in active preparation for the 6th wave to guard against sudden surge in the number of cases. So in terms of mobility and deployment of manpower, we attach much importance. Starting from the 3rd wave, different hospitals and clusters have put in place a deployment timetable so that within 48 hours, manpower can be deployed to community treatment and isolation facilities. At the same time, we will make use of collaboration apart from collaboration with the mainland, in the past there's collaboration between Chinese and Western medical practitioners and private-public partnership. So there are some private doctors who work in AWE, for instance. In the future, we will enhance our mobility, and so I guess we will have more flexibility in manpower.
Next, this gentleman. I'm from AM 730. I'd like to ask about imported cases. Yesterday, you mentioned about Thailand case, 10th day case. Is it a local case? What about the travel companion? Has that person been confirmed? In relation to the 12th day cases, is it imported or linked to a local case? And in relation to the 13 cases picked up at the airport, any of them that are non-local residents, you changed the number of designated clinics to 10. So based on what do you make the decision? Do you take into consideration the local population and as well as the booking situation of the clinics before you decide the location of new clinics? You said that the Asia World Expo facilities will change into a standby mode. Would you group patients to a specific number of hospitals or any relevant arrangements? Yesterday we reported about a case that's positive on the 10th day. We've contacted the private laboratories for them to send the sample to Public Health Laboratory Service so that we can conduct genome sequencing analysis to see whether it's a local case or not. We will compare to see if it's similar to local strain or whether it's similar to overseas prevalent strain. Regarding the 2 cases picked up by the Community Testing Center on the 12th day, the 2 people have a record of a positive test overseas. One is a 27-year-old female who has been vaccinated. We have conducted epidemiological analysis and found that she's asymptomatic. She was positive on the 2nd of April, and on the 20th of April she came back to Hong Kong via Singapore. Her tests during quarantine have been negative, and on the 12th day at the Community Testing Center the result was positive. The 2 family members who travel with them have been confirmed, have been infected in the UK previously, and these 2 people have been tested negative so far. There is a chance that it's a repositive case. We will obtain the sample to see if it is a repositive case. The other one is a 32 female, also vaccinated and asymptomatic. She came back on the 20th of April from Australia. On the 8th of April in Australia, she was tested positive. Her companion or family members were all confirmed. When she came back to Hong Kong, her tests at the quarantine hotel were all negative. On the 12th day at the Community Test Center, the test result was positive with a high CT value. We will see whether it is a repositive case. In relation to a case that was picked up, the 13 cases picked up at the airport, we don't know whether they're all Hong Kong residents or not. Sorry, speakers off mic. The speakers off mic. South Africa? Sorry, the speaker's not using a microphone. The interpreter cannot hear. You're talking about the case yesterday? No. Dr. Lee? Regarding designated clinics or general outpatient units, so far we have 23 designated clinics for general outpatient clinic, we have 73 clinics. We will reopen 10 of them. They were previously partially or wholly suspended their operation. We will look at a basket of factors, say, for example, location, population, as well as demand. We will announce any information we have once we have made a decision. Regarding patients, there are fewer patients. So patients staying at AWE or other facilities will be transferred to the North Lantau Hong Kong Infection Control Center when these other facilities are converted into standby mode. We triage patients. We aim at keeping serious and critical patients in hospitals and for others to stay at community centers. For the Asia World Expo COVID treatment facilities, it will be converted into standby mode. The patients will be transferred to the North Lantau Hong Kong Infection Control Center, which will continue to operate. In relation to other facilities, you may need to ask relevant government departments. Next. If there are no other questions, that's the end of the press briefing. Thank you.